Hello, everyone. Yes, I'm delighted to be here in this very exciting and inspiring forum. My name is Nilsy Desaint, and I'm actually leading the EU policy program of MSD for Mothers. MSD for Mothers is our company's 10-year, $500 million commitment to end preventable maternal mortality. So I don't know if in the room you all know who we are as MSD. So MSD is a global leading biopharmaceutical company. We are headquartered in the US, and we have celebrated 2 years ago our 125th anniversary. What we do is we invent for life. So for us, the SDG number 3 is the core for our business. But there is a specific target that resonates more particularly to us, and this is target 3.1, which aims at reducing the global maternity ratio to less than 70 per 100,000 live births. Why do we even bother as a pharmaceutical company? You know, we are delivering medicines, vaccines to patients. This is already a challenging business to be in. But we have chosen to actually work on maternal mortality because it's quite shocking that in 2019, women are still dying while giving birth, and also because most of these deaths are preventable. We know how to make sure that whatever happens during the process can become manageable and treatable complications and not a death sentence. So maybe just to see a bit your level of knowledge on this topic, do you know how many women are still dying in the world today? So if you don't know, I will tell you, every 2 minutes a woman dies during pregnancy or childbirth, somewhere in the world. So to give you like a visual, this is 2 jumbo jets that crash every day. This obviously will make the news, but when a woman dies, it doesn't break the news. So for us, we decided, so that you can see here our global CEO, Ken Fraser, who made a commitment in 2011 at the UN General Assembly saying that MSD will invest time, resources, and bring our business and scientific expertise to contribute to ending preventable maternal mortality. And I wanted to actually go through some of the projects we've done, share with you some of our learnings, and also how we see this moving forward. So here you can see actually the 2 pillars of our strategy. The first one is the priority countries. So it's like countries where we invest a lot. We have developed specific programs that address maternal mortality from a specific focus. So here you can see, for example, Nigeria. Nigeria concentrates 30% of maternal death worldwide, so obviously anything we can do there can have a huge impact. Kenya is our digital hub, so we're testing a lot of projects that integrate digital technologies to make sure that women can have access to information about the service they are entitled to, but also strengthening the capacity of healthcare providers. Senegal, I will go back to this in 1 minute. This is where we have tested a very interesting transformative supply chain model that solved one of the big issues that the country was facing. And then the United States, obviously this is in our backyard as an American company, but quite shocking is that the US is the only OECD country where maternal mortality is on the rise. So it's kind of an interesting fact. The other big pillar is the Global Giving Grant Program. So we have put in place a very ambitious donation program. And the way that it's working is that through our 125 affiliates across the world, our colleagues are identifying a local NGO that has a specific project that they can help work on this, either specifically reducing maternal mortality or improving access to care for mothers-to-be. And so I will give maybe some example in Europe, because 5 years ago, most of the requests for grants came from NGOs who had operation and project in the Global South. But most recently, we had our last call for application 2 years ago, and we received a lot of applications for projects inside the European Union. And it's also another striking fact is that more and more vulnerable populations, being migrant populations, but also poor women, are lacking access to quality and affordable maternal care in Europe. So we are obviously a private company. We are not an international donor. And whatever we're doing, we want to make sure that we are not replicating what others are doing. So our approach is to really bring our expertise, so our business expertise, our understanding of the healthcare environment. And whatever we're doing is to address the woman's needs. So the woman is in the center. And we have decided to focus on addressing what we call the 3 delays that cause a lot of maternal mortality and maternal health complications. This is the delay in actually seeking care from healthcare providers, the delay in receiving care, and the delay in actually making sure that we can access the care at the right time. And we're doing this together with partners. We are not there alone, obviously. I think this is a cause that is bigger than any players in the world. But we hope that by actually having this approach, we can also help the overall healthcare systems to be stronger. We know there are a lot of challenges that are being faced, but obviously in developing countries, the healthcare settings need a lot of improvement. So here's a slide that gives a summary of the results to date. This is already out of date, actually, because since we've done this slide, we are now reaching 9 million women in 48 countries. But what is important to notice here is that obviously saving a woman's life is worth it, even if you save just a few women's lives. But also what is important to note is that when you save a woman's life, you also have an impact in the broader community. First of all, the child also has a higher chance to survive, but also the family can grow, and society, economy also gets stronger. We do a lot in Middle East and Africa, as I said, because of the highest burden that we see there. I wanted to highlight one specific project we do in Senegal. In Senegal, the issue was that a lot of actually women who wanted to get access to contraceptives couldn't, because when they were going to the pharmacy, it was out of stock. And obviously, there is a clear link between maternal mortality and family planning, access to family planning options, because women, if they can space pregnancy, you have a reduction of complications when they are being pregnant. And so what we've done is that we've been working together with the government of Senegal, with the Gates Foundation, with a lot of private companies in the logistical sector to improve the supply chain. And after 2 years of the project, it was initially a pilot project, we've seen a reduction, drastic reduction of out of stock. And because of the success of this project, we are now working with the government of Senegal to actually expand the number of medicines that are benefiting from this transformative supply chain. So now we're talking about 100 medicines that are considered as essential medicines from the WHO. So here again, just an example to show that by addressing the issue of maternal mortality, you can have a significant systemic impact on healthcare. So we are today in Spain, and as I said earlier, it's also relevant to talk about maternal mortality and issues regarding maternal health in Europe. We have started our program, which initially really was about raising awareness with politicians on the issue, and to also collect data. You don't have an EU policy on maternal health, you have 28 different ones, and if you are Swedish, a Swedish lady giving birth in Sweden, you are kind of fine. If you are 16 years old from the Roma population living in the countryside, 4 hours from Bucharest, you may have an issue. So there are huge discrepancies in terms of access and huge inequalities. And the issue in Europe is really increasing. So just to give a very quick example of a partnership we have built, which is it started in 2017 with the Global Forum of Women Political Leaders. So we had a sponsorship of the President of Malta, who at that time actually chaired the Council of the EU, so we have the rotating presidency. And we had a two-day event with around 200 female politicians. Then, at the end of this conference, there was a political declaration that was sponsored by the President of Malta to highlight the need of doing much more at EU level, being at EU level, but also coordinating with the national policies. This document has been sent to all member states, and we are still referring to this in our outreach program. Obviously, you need to continue advocating for that and raising awareness, because politicians change. So now we are doing a lot of work in Brussels with the new European, members of the European Parliament. But basically, to have this kind of high-level collaboration really helps to put the issue high on the political agenda. And obviously, changing policy takes a lot of time. So as a company, we want to see changes right now for the women who need to have better access to quality care. I want to highlight two specific projects we're doing in Europe, one in Greece and one in Romania. The first one in Greece is really dedicating to increasing access to, initially was to refugee women, because as you know, Greece was facing a huge migration crisis a few years ago. And actually what Doctors of the World there wanted to do was to develop a mobile health unit so that the care could be provided to the woman and not the woman going to whatever center without knowing the language or whatever, trying to seek care. So going to the woman and not for the woman to come to the healthcare centers. And this has really contributed to really improving healthcare for these vulnerable populations. But also after 2 years, we also saw in the data that we collected that a lot of Greek women also benefited from this program. So here again, to say that we are talking here about vulnerable populations. It's not just about migrant or refugee women. It's also about women who, for whatever reason, because of financial crisis, because of their own socioeconomic background, they don't have the access to the care that they need when they are in this specific period of time. The other big project is the one in Romania. And briefly, completely different story. This is, as I said earlier, it was addressing a specific need of Roma population, teenage pregnancy that is very high. In Romania, this is the highest, the country that has the highest burden of maternal mortality in Europe. And so there, what we've done is really to try to raise awareness towards young women about their rights, so that they know what they are entitled to. Because obviously, because of stigmatization and discrimination, they're not always seeking the care, and then trying to make sure that the healthcare providers have a better understanding of what they need to be doing and a specific consideration for this population. So you see some figures here. We've reached 22,000 women in 30 communities, and we have involved around 250 healthcare providers in this project. And then lastly, I wanted to end on the digital portfolio. For us, this is the future, how we can using digital technologies to improving access to care, access to information for the women themselves, for the healthcare providers. One that is very interesting is called Together for Her. It's an application that has been developed by a company in India, and this is acting as a kind of a TripAdvisor for health. The objective is to empower women, but also for them to actually feel that they can contribute to a better healthcare system. So they can rate the quality of care they have received when they went to healthcare providers. Right now, this is really focusing on private hospitals, but in India it makes sense because a lot of women are going to the private sector for healthcare. So thank you very much. One thing that I wanted to highlight maybe here is that according to the latest UN figures, we are not going to make the targets that we have now as the SDG unless we are working all together. And I think for us, this is the main lesson, that everyone has something to contribute to, and this is something that can be solved because most of the deaths, as I said, are preventable. So thank you very much.
Nilsy, thank you so much. I have a question for you.
Yes, sure.
So MSD for Mothers has run for 8 years so far.
Yes.
What is the biggest learning for a company like yours of getting involved in such a major public health challenge?
So I think for us, there are two main learning. The first one is that with this project, as large pharmaceutical company, we had to get to know non-traditional stakeholders, like small local NGOs that we've never actually talked to. So we have different ways of working. They also got to know how we're working internally as a business. It has been mutually beneficial, and now we are really using this knowledge for other projects that are even more like business-oriented. The other big learning is that this program has been a great talent retention tool. So actually, a lot of talent retention, but also attracting new talents. Because we know now for millennials, it's not just about what is the core mission of a company that they are going to join, but also whether the company is doing much beyond what is the core business. And I think this is a great example of this. So.
Interesting. So thank you very much.
Thank you very much.
Thank you very much.